Well, whooping cough cases are on the rise in Texas, and Midland Health officials are urging families to get vaccinated. News West 9's Sonji Milburn explains what you need to know.
What starts off like a simple cough or a mild cold can quickly turn serious. Pertussis, also known as whooping cough, is a contagious bacterial infection that causes violent coughing, making it hard to breathe and often producing the distant whooping sound. And Dr. Whitney Craig, Health Services Manager at the Midland Health Department, says cases are rising fast.
We had 2 cases this time last year, and we are up to 21 this year.
And it's not just local. According to the Texas Department of State Health Services, Texas has seen more than 3,500 cases through October. And Craig says it can be confused with a common cold.
As soon as you start noticing symptoms, up until 2 weeks after that, those coughing fits develop. You can have symptoms of whooping cough, pertussis, for weeks. The introduction of antibiotics can decrease how long you are sick.
One of the biggest concerns is serious complications, especially in infants.
A severe complication of whooping cough is apnea, and that is when you you stop breathing. And so of the children that are hospitalized under the age of 1, 68% of them end up with apnea.
Health officials say the best protection is vaccination, and it's recommended from infants 2 months old through adulthood. Aside from getting a vaccination, you can protect yourself by practicing good hygiene, washing your hands, limiting close contact with others, and coughing or sneezing into your elbow. Reporting in Midland, Sonji Milburn, News West 9.